Now, the American Academy of Pediatrics has new guidelines to treat them. It recommends treatments like motivational interviewing, intensive health behavior, and lifestyle treatment. But you know what else is on that list now? Weight loss drugs and bariatric surgery. Now, I know the idea of surgery and drugs to help kids lose weight is a lot to think about, but it's not as cut and dry as that. These treatments are not the first step doctors take for weight loss. These new recommendations are for the most extreme cases when other treatments haven't worked. Joining us now to discuss is Dr. Susanna Hills. She's a pediatric surgeon at the Columbia University Medical Center. Doctor, thank you for joining us on this. It's certainly a talker when you see headlines like suddenly kids could be getting surgery for something like this. So let's dig in. And first, I just want to know what you make of these recommendations.
I think it's really important that we're addressing obesity in children in a multifaceted approach, right? They're including behavior, they're including counseling, lifestyle, but also we're adding medications and surgery because obesity is really complicated and it's very difficult to address in children. So they're sort of adding some other tools, some other levels of care that will be options for physicians to provide in the right setting.
So for someone who does read that and they think surgery for kids, that's ridiculous, or that can't be right, or that must have a psychological impact, walk us through how that would be the treatment that's prescribed. What would be the path to get there, and what sort of case would that be in?
Yeah, I think most physicians would agree surgery is a really aggressive approach, right? But then you have some rare cases where all the lifestyle and behavioral modifications you recommend are being done. Kids are doing everything they can do to reduce their weight, and they're still in a category where they're at high risk for having complications from their for an intervention like that.
So we just had that stat, I mean, over 14 million children. And I'm wondering, obviously, that's 14 million sets of parents, or 14 million single parents in some cases, of course. What is it like to talk to parents about this? I imagine there's probably quite a few parents who just think, you know, my kid will grow out of it, or maybe there's a growth spurt and things sort of even out. I mean, what is it like to really have this conversation when it's at the point of someone being morbidly obese and that actually really impacting their health and their development?
Yeah, it's difficult. And I think our priority as physicians working with kids needs to be to destigmatize the conversation. So to me, that means talking about it like any other medical condition, like asthma or allergies or a kidney problem. It's a medical condition. And to be able to speak freely about that issue and to talk to the child about it too, so they know it's okay to discuss. It's okay for them to talk about it like any other health problem they might have, and so they understand that they're involved in the process. Because ultimately, success in dealing with obesity involves the actual patient, that child, being able to make the right choices, being involved and taking responsibility for their own nutritional choices that they make and exercise choices and other factors that come into play.
And have them understand, especially with guidelines like this, that there's hope for it to get solved. Yeah,
exactly.
Absolutely. Dr. Susanna Hills, thank you so much. We appreciate you coming in here tonight.
Thank you, Savannah.